And welcome back to the show. Acacia Network provides integrative, culturally competent, and trauma-informed programs in the area of health, housing, social services, economic development, and cultural revitalization to more than 150,000 individuals annually. Now, the organization has been sheltering many of the newly arrived immigrant families that have been bused from Texas and the transitional housing sites and connecting them to medical care as well as medical health services. And joining us now to share more details, we are pleased to have with us is the Population Health Director of Acacia Network, Dr. Jessica Sessions. And Dr. Jessica, good to have you with us.
Thank you for having me. It's wonderful to be here today. I'm very happy
Glad
to
to have.
have this opportunity to talk about something that we feel passionate about and something we've been really taking an active, proactive response to.
Right. Well, I think a lot of people are worried about the condition of those persons who are coming, right? And I know that you're taking good care of them. But let us know for those who are arriving, these migrant families that are coming from Texas, how's this transition been going from your end?
So, I'm a pediatrician. I work at one of our health centers, Ramon Velez Health Center in South Bronx. Acacia has really worked, it's multidimensional because we do have many different shelters that are housing these immigrants. So from a primary care medicine perspective, the site has been working with the shelters and trying to provide services for these migrants. And I think first off, they come here all hours of the day and night. They get put into a shelter, a residence. Some have kitchens, some don't. They're not speaking the language. So they're feeling completely overwhelmed, really scared, very grateful to have, a bed and a roof over their head and food provided. But you sort of get here in New York City, which can be just like crazy and overwhelming because it's large, bustling, lots of things going on. And they really are just trying to piece together, what is the next step? What do we do? So here at Acacia with our primary care sites, we have been working with people in the residences and first of all, just trying to get medical services to the families. So that has involved just like transportation, like how do they get from one place to another? They don't have a Metro card, they don't have money. So we have worked with Uber Health and certainly like getting these families to the medical center where we can provide a full assessment of their medical needs. We also have had our mental health professionals, our social workers here to really do more of the trauma-informed care and really assess families where they're at, like their mental health, their emotional health, how they're feeling, how they're sleeping. Here we've been seeing lots and lots of families. So that means like children of all ages. Babies from a few months of age to teenagers. And often there is very few records. So we don't really know about vaccination status. Many of these children have been not having very good nutrition because they've had a long journey to get here. So they've had like limited access to food. So they are coming with a lot of sort of nutritional issues, gastrointestinal issues. But sort of like that's where we start is just like they're here. How do we get them here? And then once they're here, our primary goal is to be like a safe and welcoming environment. So that means like greeting them in their language, kind of just explaining what are they doing here and what are the next steps, and just things like offering them food, while they're waiting, because it can be a long day here in the health center.
Absolutely. And I know that one of the things that you talk about in your organization is really during a situation like this about how to be trauma informed and also how to be culturally competent. And so when we talk about being trauma informed and culturally competent, make that make sense for the average person who's watching right now. How does Acacia go about doing that?
So, culturally competent is really understanding that people come from different backgrounds. They have different traditions, different beliefs, different languages, different thoughts about healthcare. So just understanding like, where do you come from? What kind of beliefs and views do you have about medicine? So culturally competence, speaking the language, giving things to them that they can read and understand in their language, and meeting them where they're at culturally and having that respect for diversity. Trauma-informed care, I like to think of it as you're not looking at the patient and saying, what's wrong with you? But you're saying, what's happened to you? Trauma-informed care is understanding that patients have been through a lot of different things in their life. So the way that they're coming at you is you kind of have to understand the whole person and be sensitive to what they have been through when you're providing care. You don't want to re-traumatize patients, but you want them to feel safe. You want them to feel listened to, okay? And when you're treating that person, you're treating the whole person, not just like what you see in front of you or what they're presenting with.
For our viewers that are just joining us, talking about the Acacia Network, really working to help out those who are the Texas migrant community coming to New York City. Acacia at the forefront of making sure that services are being provided. And Dr. Jessica, for somebody who doesn't know about Acacia, why don't you just give us a little background as to who Acacia is and where you guys are?
Okay, well, believe it or not, Acacia is a real thing. It's a tree found in the desert, which has it provides like a large sort of canopy of shelter. So Acacia got its name from this desert tree. And I like to think of it as like the network, the Acacia Network has very deep, deep roots, which you have to do when you're in a desert. And those really deep roots, those are all of our staff, like super dedicated, really wanting, it starts with an excellent, well-trained, dedicated staff, right? Those are the roots of the tree. And then the network, it is a very large network, but what it's here to really do is nurture and provide shelter and sustenance to the areas of greatest need, right? Which the desert is very needy. We are in areas of the South Bronx. We're in needy areas in the state, like Dunkirk and Albany. We're in other states in the country. We even have services available in Puerto Rico. And we are here to provide that nurturing and that sustenance to people who really need it. We're here to make the community better by providing resources, not only in shelters, but affordable housing, as well as healthcare, mental health, behavioral health care, as well as addiction services. We have social services, workforce development. We have Head Starts, early education. We even have cultural revitalization agencies in the city. You can find us all through New York City. It's not just primary healthcare, it's truly multidimensional and very wonderful mission. And we are here to provide those services to the patients that need them most.
Well, Dr. Jessica, I want to thank you for being with us here today. A lot of information. And as you continue to provide these services, thank you for looking out for those who are really in desperate need and really helping to bridge the gap, because I know what it's like to be in another country and not speak the language or know the language. So definitely thank you so much for that. And great having you.
Thank you for having me. Really appreciate it.
Well, we want our viewers to know now, if you want more information, all you got to do is don't hesitate. Go ahead and visit the website at acacianetwork.org, and then also follow them on social media at Acacia Network. We encourage you, don't go anywhere. Open continues coming up right after this.